Excited to spread awareness and recognize those living with rare disease. We have an amazing turnout today with well over 175 people signed up for our program. And I can't thank you enough for taking time out of your day to join us. Today, we'll be speaking about the effects that COVID has had on our Duchenne community. In specific, how our families have persevered through these uncharted times, how individuals have received care, and how research is being conducted. At this time, I'd like to introduce our moderator, James Valentine. James has been an advocate for rare disease patients, including those in Duchenne, for over 14 years. This began with his time in the Food and Drug Administration, where he served as a patient liaison to ensure patients and caregivers had a voice in agency decision-making, both on a product level, as well as developing new opportunities for engagement. After his time at the FDA, James joined a food and drug law firm at Hyman, Phelps, and McNamara. He continued expanding his impact in our community by working to help those developing drugs for rare disease navigate the FDA's pre-approval gauntlet. And he continues to put our patients at the very center of his work. He's helped numerous orphan drugs get approved, including ones in Duchenne, and in 2019 was recognized by Global Genes with a great award, the Rare Champion of Hope. It's my great pleasure at this time to introduce to you James Valentine.
Thank you so much, Eric, for that kind introduction. And it's such a pleasure to be here today with you, the Jett Foundation, and this Duchenne community, one that I've gotten to know and love, and as was just described in my many years of working in this rare disease space. Today's really a unique opportunity. While COVID-19 has seemingly impacted every aspect of society, every aspect of daily life, we get an opportunity today to focus our agenda on those impacts that may not have been the ones that were captured in the headlines of newspapers, or maybe were the greatest topic of the proverbial water cooler talk around offices or neighborhoods over this last year. Today, in celebrating Rare Disease Day, we get to focus on the impacts that the pandemic has had on those living with rare diseases, as well as important aspects of their care and research for therapies to improve their lives. And of course, we're specifically doing this within the lens of Duchenne muscular dystrophy, and we have a great agenda lined up here today to explore those topics. So without further ado, I'd like to introduce our program for today and get us into our first discussion. We're going to spend the first period of time that we have on the agenda today to hear directly from our community, caregiver perspectives of individuals who care for those with Duchenne, and their experiences, as well as some of their perspectives about what it has been to live with Duchenne during the COVID-19 pandemic. And to help us in exploring this, we have our Jett Foundation community ambassadors. For those of you who don't know the Community Ambassador Program, this is a program that was launched in 2017 with the aims to spread awareness about Duchenne and the programs and services that the Jett Foundation provides. And through community ambassadors who constitute moms, dads, grandparents, even siblings who are already familiar with the Duchenne landscape. So these ambassadors, they serve as the Jett Foundation's extra ears, eyes, and in the Duchenne community. They're advocates, resources, and really pillars of emotional support. So knowing a little bit that we have that, I think that background will let you know our ambassadors are the best positioned to help us understand these experiences. And just to introduce them as a group, they'll be really telling you more about themselves. We have Jessica C, Jessica R, Diana, Blake, and Laura, who will be sharing their experiences. So to get us started here today, I have a question for the group. And this one, I'd like to hear a little bit from each of you. and in doing so, hear a little bit about yourselves and your experiences with Duchenne. But let's start with the big question. What has been the biggest impact of COVID-19 on your loved one with Duchenne? And maybe we can go in that same order I mentioned and start with Jessica C.
I think for us, COVID-19 set us back socially. We don't see family as much. We're not able to venture out to the movies and those simple things that we tend to take for granted.
Yeah, and so Jessica, in thinking about that, things that we would take for granted, things like going out to movies, can you describe, what about COVID-19 has caused that type of restriction or impact in your family's life?
I mean, for us, we limited where we went during flu season on an annual basis, and this just extended further into the year. This became a year-long event. We're always hyper aware of the germs and different things that are happening in the community, and this just, we tend to look forward to that spring, summer time.
Yeah, so this kind of your extended flu season activities. I mean, so this in general, what did those look like? Was it just avoiding crowded areas, or was it more than that?
It was everywhere from crowded areas to waving at family members from the porch or the window, doing a virtual visit with the grandparents. Physician visits, clinic visits, everything. It was a big hit.
Sure. And what is this kind of, maybe Javon was used to it from doing it in flu season, but I think this is very unprecedented. What's the impact been on him?
He wants to go do things. He wants to, we obtained an accessible van through the Jett Foundation in 2020, and yet we've been limited on where we can go.
Sure. Well, thank you for starting off. We're going to dig into some of these topics a little deeper, but just to hear what is the biggest impact on COVID-19 from another perspective, let's go to Jessica R.
Hi, I'm Jessica. I have a son, Wyatt, who is 14. We live in New Orleans. So our biggest impact is really the anxiety part of it. So as many of our kids with Duchenne struggle with the anxiety and behavior parts, the anxiety is what really took over Wyatt. So he was scared to go anywhere. Pretty much from day one, he said, if I get this, I'm going to die. And so, like Jessica said, you just change everything. You stop going places. And I swore I wasn't going to cry. But Wyatt also has a little brother who is 11, and he's got 10 friends who live in the neighborhood. And so we also had to limit him from going out and being an 11-year-old. And so we tried to change our lives but we needed to make sure Winston wasn't blaming Wyatt. So we had a lot of balancing of being able to do things and let it a little loose and keep Wyatt's anxiety kind of at bay. And so that was probably and still is one of our hardest challenges, because the 11-year-old wants to go everywhere and do everything. But otherwise, we still, we have traveled some for trials and for vacations, and it's just a lot of change to make it happen and make it happen safely.
Sure. That's really, impactful to hear. And, how has Wyatt handled kind of it sounded like over time you found certain activities that your other children could do. Maybe it was, certain, things that kind of had acceptable levels of risk. Was Wyatt okay with that? How has he handled that?
So I think over time, over the year, he's really figured out a lot that we really have taken the steps to make sure he's safe and that we're not going to go and really put him at risk if it's not worth it. His brother's mental health is just as important as his. And so we really tried to just make sure everybody was good. But he's taken control of his own situation. He would wear 2 masks. He washes his hands. He just knows where he can and can't go. He didn't get a haircut for a year. It was down to his shoulders, but he's moved to where he's a little okay with it and has gotten better and has gone out more than before. But I think him kind of taking a little bit more control of his environment has definitely helped.
Well, thank you, Jessica. And we definitely want to probe more across the board around impacts on families and family dynamics in a little bit later in the discussion. But thank you for raising that here in this first question of biggest impact. Just continuing to go around robin here. Diana, what has been the biggest impact of COVID-19 on Jordan? Oh, Diana, you're on the mute.
Sorry about that. So I'm Diana. I'm from Connecticut. My son Jordan is 6 years old. So I think the biggest impact on Jordan, I mean, of course, socially, it's been another barrier for him to make friends. We just moved to a new town, so that's been difficult. But I think the biggest thing he noticed was the change in the doctor office and hospital setting. And I think everybody that's been in a doctor's office since COVID hit knows it's a very cold, sterile environment now. So Jordan doesn't really like to be there. So it didn't used to be a struggle to get him to the appointment, and now it really is. So that's been our biggest change.
Very interesting. And it has been mostly about the environment itself, not about just worrying about, being in a healthcare setting and having risk of infection, or, just for him and where his mindset has been.
He knows the coronavirus exists. He knows what viruses are. He doesn't really understand too much about how he can catch it. He really doesn't understand too much about his condition, but he knows that, obviously he can't stick his hand in the same treasure box and pull out a toy the way he used to, that 10 other kids stick their hand in. And those things don't seem like a big deal, but they are a big deal to Jordan. And I think that they made that environment less scary, more welcoming. And without those features, it's just a doctor's office, and he just doesn't really like to go. And we unfortunately do have to go often. So I think those changes to the physical environment of the hospital have impacted him the most.
Sure. Thank you so much. Blake, can you share what has been the biggest impact of COVID-19 on Will?
Sure. So my name is Blake. My son Will is 13 and has Duchenne, and he has 2 little sisters, Caroline and Olivia. So of course, we share a lot of the same concerns as all the other caregivers, that, it's how do you balance that neurotypical child with your child who has, medical complications, and is at greater risk. But I think there were 2 reasons that kind of really struck me as like this COVID is, first of all, I think everyone's experiencing a tiny slice of our normal everyday life. And, like Jessica was saying, I mean, when flu hits, we're prepared. We're prepared. It's in his IEP that he may miss school or require, in-home services. So if there is a massive breakout at his school, so everyone's starting to feel a little bit of the inconvenience that we feel on a daily basis. We're used to plans not going according to what we want, and we just learn to adjust. We live in this perpetual plan, Z sometimes. And I think people are witnessing that and experiencing that. And that sometimes is hard, because when you hear people frustrated about, their children need to be back in school because they need in person, because that mental and that isolation, we still have that too. My son's mental health is just as important, but I also want him alive and not on a ventilator. So I have to balance that. And so, and that will continue to hit us. But I think too, it put a microscope on, we moved to Colorado in 2019. We don't have family here. We don't have a big support system. So the caregiver burden is real. I mean, it's 22 hours a day. You're the PT and OT. You're doing the telehealth visits. you're the lunch lady, you're breakfast number 2 lady. I feel like, I mean, it's an all day gig, and you're trying to balance that with the flex, we're fortunate, both my husband and I are able to work from home, but we're balancing, careers in, the same space as our 3 children who are trying to do at-home schooling. We're isolated, we're stressed, and we're trying to just put on a brave face. So, I mean, it's just, it can be overwhelming at times.
Yeah, you covered a lot there. I mean,
I'm very passionate about this.
And I think it's hard to say that there's any one biggest impact, but one thing that you said kind of stood out to me, which is, that in terms of providing care, you're providing all of the care, and that's a big change from, usual life and usual way that Will receives care. How has Will responded to kind of this new environment where he's getting all his care from you, and you guys are spending lots of time together? I'm sure there's lots of silver linings, and we'll talk about that later, but what would you say overall, how has Will adjusted to this new normal?
I think he's handled it in stride. I think he and he's always had a positive outlook, and so I think as much as he likes consistency and routine, he's been able to roll with the punches, and that made us pivot. We started out at virtual school through our school district and realized he wasn't getting services. And it was causing stress on our relationship. We were butting heads. So then we said, halt, we'll just do homeschool for this year. And, I think it wasn't his choice. I mean, he's counting down the days till he can go back to in-person school, but I think he recognized that, and he is too abundantly, like someone else mentioned. I mean, he's very cautious and very hesitant to have outsiders come in, and he monitors our circle and that sort of thing. So, I think all of these kids are facing really adult-like situations and scenarios where they're having to navigate, and they're watching us navigate, and we don't have the answers. And so but he's done resoundingly well. I mean, he's isolated, and that, worries me. But as far as rolling with the punches, he seems to be doing pretty well.
Sure. Well, thank you so much, Blake. And last but not least, Laura, can you tell us about the biggest impacts on Noah?
Sure. My name is Laura, and Noah is my son. Noah is 22. He graduated in May with his associate's degree. His associate's degree was all virtual. So he worked so hard for years for that, got honors, and we had to do it sort of online. So that was kind of hard. He also got a van through the Giving Fund, and that as well, no celebration. I mean, and we can't go anywhere either. Like Jessica said, there's not too many places we can go. But what it really did is it changed him. He decided he wanted to take a gap year because he's terrified. He said, if I go in a classroom and I sit there and I talk with regular kids, he said, I'm going to get sick. And he, again, like Jessica Rownd said, he's afraid he's going to die. And that's kind of the reality now at 22, when you have a compromised lung function, right, and whatnot, and compromised immune system. And he has now taken time off. So we've been out of school now, and I'm his scribe, so I go to school with him. I'm also his not 22 hours, 24/7 caregiver. So I have that burden as well. So that's been hard. It's been very, very isolating. But he doesn't want to see anyone. So even his respiratory therapist, if she comes to the house, I undo his machine, take it to the front door, puts gloves on, she looks at it, downloads it, and then I bring it back to him once I've cleaned myself. He's very anal on how many germs are around him, as I've kind of taught him to be, which, I mean, you have to be at this point. And so he's had some struggles. It's just been hard because he's, just keeps pointing out to him that there's other college students his age that can go, put a mask on, they can double the mask up, they can go and sit there. It's too much of a risk to him, and it gives him way too much anxiety. So he's like, I'll just keep waiting. And luckily he's a smart kid, and he knows, at some point we'll have that vaccination, because we're still waiting for that. So that's another anxiety here. But he's on lists and we're just waiting. So
yeah,
basically, it was a lot of education that was really in jeopardy for him and made him really isolated. And
yeah, no, that, you know, I can feel his anxiety coming through in your comments, just sharing that. And the decision to take a gap year, you know, that's a big decision for anyone.
Yeah.
But, you know, for Noah, having worked so hard to get his associates and now have that opportunity, you know, is he, you know, feeling like that there might need to be another gap year, or is where kind of are you now that we're this far into it? What's his thinking? Is he thinking maybe, you know, I don't even know, just throwing this out there, is he thinking about doing something virtual, or does he really want to wait until he can be back, you know, in the classroom, you know, in that environment?
Yeah. Well, for him, he wants to be an atmospheric scientist, so there's a lot he has to do in person now because he's already the associates. But I think he's kind of on the immunity. He keeps talking about herd immunity. And so don't really, I mean, I think there's definitely the thought of, do I need to take another year? Because he gets mad at so many people that won't wear a mask or don't think it's real. So it's a possibility there might be another year of that, but hopefully not, because I think he's kind of going a little stir crazy, and so am I. So we'd like to get him going, and with Duchenne, time is precious. And he'll be 23 next month. I mean, we've got, you know, time is ticking, and we would like him to get what he wants to do, you know, do what he wants to do. And so whether there's a pandemic or not, it's somehow we're going to figure it out and get him through. So
Sure. Thank you so much for sharing that, Laura.
Oh, sure.
And
Thank you.
I think, you know, just from this very broad starting point, you know, we've heard everything from impacts on receiving care to, you know, a number of impacts on family and other relationships outside of the house. We've heard about impacts on education. You know, so really, you know, all really important aspects of quality of life that have really been, you know, upturned here as a result of the COVID-19 pandemic. I do want to dig a little deeper on some of these themes, and I'd like to start maybe with a focus on educational activities. And, you know, we've heard about some of the impacts, including even taking a gap year for Noah, you know, before starting up his collegiate program. You know, but I'd like to hear any things that have been altered or impacted because of COVID-19 for your sons related to education and educational activities. And so here maybe we'll start in the middle and start with Diana, if you could share any of those, again, modifications or impacts as a result of COVID-19.
Sure. So as I mentioned, Jordan's in first grade, and he walks. He's not in a wheelchair, but he does get tired throughout the day, specifically towards the end of the day. So in kindergarten, he was using equipment in the hallway just to get from like his classroom to the art room or something like that. Now everything is within the same room, so he doesn't need to be pulled out. So that's been good at saving his energy. But I do think he might be a little uncomfortable getting like his physical therapy in the classroom with the other students than he would have just himself and the therapist. You know, Jordan's, you know, aware that he has some limitations. He doesn't obviously know the extent of it yet, but at that age, you really just want to be like all the other kids. So I think it's definitely shined a light on the fact that he does receive so many special ed services throughout the day that maybe weren't noticed before. But again, the good part about that is he's staying in one place and he's able to actually stay the whole day at school and participate in the majority of activities. So there's been some positives and negatives for Jordan.
Sure. No, thank you for that. That's very interesting. I don't think something I had realized was happening in terms of keeping everybody in one room to just, you know, at least you're creating one bubble. Then. Right.
For the cohorting, they want to limit that as much as possible. So that's been beneficial, I guess, for Jordan.
Sure. And any you know, kind of COVID scares within that one cohort or bubble?
He has not had any quarantining within his particular classroom. There have been scares within the school itself. We've been pretty isolated though. When I made the decision to send Jordan to school in person, it was kind of like, that's all he's going to do is just go to school, because we did have the choice to keep him home and do e-learning. But as I mentioned, he was starting a new school in a new town. So I wanted him to meet people and be there. So, I had some mixed feelings about that. That was a tough decision, whether or not to send him to school. And I think ultimately it was the right decision for him.
Sure. Well, it sounds like kind of cohort approach work then, if others have had scares, but you didn't cross over into Jordan.
Yes. I mean, I think not only are we careful about staying away from other people, but other people are careful about being around us. I mean, no one wants to be responsible for bringing the coronavirus into a house that's already vulnerable. So we've definitely no one wants to come here anyway. So I think it's been okay in that way.
Sure. Thank you, Diana. Jessica R., any impacts on educational activities?
Definitely. So since March 13th, we've all been home. And then we made the decision to keep Wyatt e-learning through the whole year. His brother went off to school, but we kept Wyatt home. And so now he's very attached to me, very dependent. It's me all the time. So I'm there scribing for him and then working through problems. And then I'm the physical therapist and we're going to doctor's appointments. It's been good and bad in a good, in a way. So we're able to go to doctor's appointments without it messing up his school life. But I think he's become very dependent on me. So his plan, and he has told me he's in 8th grade now, is that he is going back to school in August. He will be in high school and he's super excited about it. So I sure hope it happens because now it's a plan and that must happen in his head. But it's been a challenge. It's different.
Yeah. So, you mentioned that he's become very dependent on you, but it also sounds like he's, because he's got this plan on the horizon, he's got you and he have an exit plan for, maybe getting, having him be more independent.
Yeah, I think he might be a little tired of me, but he does like being at home and the flexibility of being home and e-learning. He can sleep longer, so I'm not waking him up. And so he's got more energy through the day. And so, and he tells me he can eat whenever he wants to. So the structure of in-person school, that burden has been, relieved. But it'll be interesting and a nice slow transition into in-person school next year. We've already told the high school that.
That sounds good. Thank you, Jessica. Our other Jessica C., anything to share on impacts on educational activities?
Not specifically here. We've homeschooled for the last 6 years, both children.
Mm-hmm.
However, it does limit the ability to, again, go join any groups or go participate in anything, go to the park, because everybody's at the park during the day now, rather than you used to have it to yourself. So, there's that.
Sure. So that's kind of interesting, though, just to think about in contrast, experiences. You've been doing the kind of the homeschool, not really, I guess, virtual learning, for a long time now. And, as you've seen others, not necessarily just others in this community, but maybe others in your community, your geographical community, do you think that that's, made it easier, that better continuity of kind of learning and education as a result of your experience with homeschooling?
I mean, I think, like Jessica R. said, that there's the good and the bad. I think people have experienced a better quality of life once they figured out their routines.
Mm-hmm.
But at the same token, they've also learned, I'm sure Blake's experience with homeschool life, there were certain perks of homeschool. You could go places during the week when nobody was there, and you kind of had it to yourself, less germs, less stress, all of the above. They've learned that way. So.
Sure. Well, since she called you out, Blake, anything that
You're
you want
welcome.
to add here on impacts on educational activities?
Yeah, well, first of all, I want to say Jessica, our son, and my son probably need to get together because they sound like two peas in a pod. But we, like so many other people last spring, like realized how much we were dependent on services for Will. I mean, he has very limited arm function. So, I mean, even the simplest task of opening a laptop requires an assistance. And you know what? The school district was great about switching to e-learning really quickly last year, but we quickly realized those services he needs to access it didn't come with the package. And so, we were struggling, and even on, good days, I mean, technology wouldn't cooperate and everything else. And it felt like it caused him to quickly lose interest in school. And this is a kid that loves school and loves learning. So, we kind of figured we would, over the summer, we evaluated, the school district launched a virtual school that was standalone in itself. But then it was all new staff, and the class sizes resembled college classes. And so once again, his needs weren't being met, and I was having to, yell loud and be that squeaky wheel. And we just quickly realized, like, that no one's winning in this. We'll just chalk this up to a lesson learned. So we, went the homeschool route, and we have enjoyed the flexibility. We do stretching multiple times a day, which we didn't have that luxury before. And we've incorporated swim therapy and things like that. But that, interaction piece, and for him, I mean, has his heart set on public high school next year. And I worry that we've lost some of that stamina because he hasn't had to have it. He was in a good rhythm with regular bricks and mortar school. And, now that we are a little more loosey-goosey, is he going to be able to handle a high school workload, all the transitions? And we're starting from scratch. We have to reevaluate for IEP. We have to find a new para and everything. And it's just, he's gung-ho and all aboard. And I'm like, oh my gosh, I don't know if I'm up for this yet. So, but you do what you got to do.
And when you say stamina, are you referring to just, the full length being, constantly on all day, or navigating in terms of mobility, getting from classroom to classroom, or something else?
Well, I think it's a little bit of both. I mean, in middle school, he had kind of things, the wing of the building was designated for his grades. So the class to class transitions, going to the locker was all right there. It'll be a whole new game that, in high school, and the workload. And I think he's just, we do about 4 hours of homeschool a day, and then transitioning to, an 8-hour school day. Plus he loves riding the bus. So that's an hour on either side of a school day. I mean, I don't know if he's up for a 10-hour day. I mean, I'm hoping so, but as a parent, you want to protect them too. You don't want them to wear out, or so it's a balancing act, and I don't really have the answers, and I wish I did.
Thank you so much, Blake. And Laura, since you already spoke so much to, the educational impact, I actually want to transition to another topic that I think is really important, and we've heard a little bit about so far, which have been any unique challenges related to care for your son as a result of the pandemic. And this could be, anything from, access to medications, access to healthcare providers, or even just the different strategies and approaches any of you and your sons have taken. We've heard PT, OT, things like that mentioned a couple of times. So Laura, I would love to have you start us off on this topic of, unique challenges to care during this pandemic.
Sure. So Noah has several telehealth visits. We do anything we possibly can virtually, so he doesn't have to go down there, see whoever. He does go to Duke, and he's scheduled actually to go Monday. And right now I'm discussing it with Duke, trying to get him another telehealth visit, who has not returned my calls in 2:30 on a Friday. So that'll be, so there's been several times. We did venture up to Michigan and stayed with my mom, who was quarantined in the summer. So what we did in Michigan was we did a telehealth conference with the doctor at Duke. So that was kind of nice. And so they saw him and saw he was okay and everything. And that way we got refills on medication, because there's so many times that you have to see You have to see specific people to get the care that your son needs, and they have a whole care team and some people involved. And it's hard to organize all that. But in some ways, COVID has kind of helped a little bit in the fact that every one of these providers does have a telehealth option. Like there is a way to see a doctor without seeing the doctor. And that has really lowered his anxiety, which is huge, because once his anxiety's up, then the heart rate's up, then, you know, suppresses his lung function, then we have a whole nother thing going on. So that's been interesting to do the whole telehealth route, getting the med refills that way. But he has a cardiac MRI that's been rescheduled 3 times. And actually only once by me. It was by the other providers trying to get the right people with the right equipment, because my guy's a little taller, a little bigger. And so he needed a bigger MRI, and it's just become kind of hard in some ways to organize that and to be always the middleman, always the one. I mean, you've always been, as a caregiver for Duchenne, you've always been the one that has had to step in and kind of take over and say, okay, this is not right, this is, and be that advocate for your kid. But it's literally, like I think Blake said, you're supplementing all of their needs in every way. And so in some ways it's become exhausting, kind of. It's a little overwhelming, but it's just, you know, one day at a time, and you're just doing what you had to do normally. And in, you know, a silver lining that we're going to talk about later is that maybe I don't have a 4-hour drive to Duke. I can, you know, hop on Zoom and say, hey doctor. So that it's kind of been good. So
Yeah, no, really. Thank you for, you know, you kind of hit on a lot of pros, but also some of the trade-offs of telehealth and not having that in-person opportunity to, you know, advocate and coordinate. But you know, definitely the reduced, you know, removing a 4-hour drive sounds like something very important for Noah, and you know, also the anxieties of, you know, that he's having right now because of COVID and not having to have that. So thank you so much. We'll keep going around here on this important question of challenges related to care for your son, and go to Jessica C.
I'll be the first one to tell you that virtual PT is no fun for anybody. No sooner than you get them up, they want them down, and that's no fun. But you push through. One piece that we ran into during COVID was, and has been, equipment. Getting equipment that's personalized, sized, individualized for your child. It took us 4.5 months to receive a sliding shower chair, the toilet to the shower. 4.5 months from the time insurance finally approves, has a staff there to approve, whatever it may be, to the place that's putting the piece together. 6 months with a stander. And that's just time, again, that we all continue to speak of, that we're losing, that we're either at risk for a fall, we're losing digestive health, you know, all these pieces that are just falling through the cracks.
And can you maybe help me understand, you know, what was it, you know, because it had to be all done over the phone, or what about COVID, you know, kind of made that process?
Right. So of course, you know, you have somebody that'll come out, measure you. We'll do that. We measure the bathroom virtually with him on video. That was fun. But the places that are building these pieces were staffing challenged. The insurance companies were staffing challenged. They had made cuts as people worked from home. So there were all these hits in every direction.
Wow. That's something, you know, one of those unanticipated consequences, something you would definitely less obvious from the outside. Jessica R., any impacts on Wyatt's care?
Honestly, we've been really lucky here in Louisiana. Surprisingly, we've pretty much stayed open. All of Wyatt's physicians have had in-person visits. We traveled to Columbus and they wanted us up there. So we flew there and had his regular in-person visit. We have not delayed any visit, including dental visits, throughout the whole thing. So I'm probably not the best person to ask, but we were lucky enough that everything kind of fell into place for us.
Sure. No, and everybody's experience will be different. And I mean, that's, I think hearing some of the differences from geography to geography is interesting too. I want to give Blake the last word on this topic. I know, Diana, you had talked about this a bit already with Jordan. So Blake, can you share any impacts on care for Will?
Sure. I can't say enough about how wonderful our care team here at Colorado Children's are. And, we were fortunate in the state of Colorado that they approved telehealth quickly. So while we didn't miss a step in our spring clinic visit was, pretty much virtual, or it was virtual. We didn't see all the specialists. It was hard because that was our second time at the clinic. So, they're still getting to know us, and here we're thrust in this virtual, and then in the back of your mind, you're kind of going, how good are we doing at monitoring the progression of the disease? We don't have the everyday benchmarks of going through school days and things like that. And, they're looking at us through a screen. So how accurate are we? Are we taking some of it for granted? But there were some good things. We did switch Will from a weekend dose, or from an everyday dosage to steroids to weekend dosing, because we felt, well, we can monitor it. We can see, we don't have to send him off to school wondering what, after 3 days of not having a steroid or whatever. So that transition to us brought us a little more peace of mind, and it was a great thing for him. Where he's able to conserve energy. But then, on the flip side too, we also had he gets a weekly infusion. So, having nursing care coming into our home, he's a tricky stick. I've been trained to administer it, but he's a hard stick. And so a professional nurse is needed. And, that was scary, because then the nursing agency's wanting to train back up in case she gets COVID. And you're like, not only do I not want her in the house, I don't want someone I don't know. And, and we were having telehealth for a while. And as mentioned, PT, OT virtually is horrible for everyone involved. But then, having them come into your home, I trust them, but then I have to trust every other family that they see, that they're taking the same precautions as us. And it's just, you just feel like you're gambling every time the doorbell rings. And so, but that was, I put my foot down with the nursing care. I was like, no, if she doesn't get it, then we'll just have to miss infusion, but we're not having additional people come into our house. But it's hard.
That does sound hard. And where do you draw the line, providing protection for your son, but, also getting him the care that he needs. So thank you all for helping answer this question. Something a little bit related, I know, and very topical for Rare Disease Day, is in many rare diseases, including Duchenne, care, part of the standard of care often includes participating in clinical trials. And so, the line of work that I'm in, I see lots of impacts that the pandemic has had on clinical trials, but I want to see if any of our panelists here have had any experiences where their clinical trial experience has been impacted by COVID-19. And maybe we can start with Jessica C.
We actually, who knew that COVID-19 would be, 2020 would be when we would join and be accepted into a clinical trial. I will say the screening phase was, it's lengthy, can be difficult. So you're already risking traveling once, and then it's, hey, can you come back in 2 days? Oh, you need to come back again. So in my mind, all I was, oh, here we go again. You hope that your travels are safe. You hope that where you're staying safe. You hope that the people you're going to see are being safe. But we persevered, and we keep trucking every 2 weeks.
2 weeks. And then just to clarify, every 2 weeks, that's an in-person visit to the clinic?
That is an in-person visit.
Wow. Anyone else on our panel have clinical trial experiences to share? Jessica R. And then Diana.
Yeah, so we kind of had 2 clinical trial experiences through this. So Wyatt was in one trial that was canceled over the year, and then started a new trial. So we ended one, and then we decided to wait to try to figure out what we were going to do next. And because of COVID, it was delayed. We knew there was one he could possibly qualify for, but they were putting it off because they couldn't get us there to screen. And so eventually they did. They called us and said, if you're ready to come, we're ready to have you. So we went, and he did get into the trial, but then that came with how many times are we flying and what are they going to do to help relieve some of the burden of flying all the time, which I think has been a blessing. We, instead of flying back and forth, they did labs at home. So things that we would have just been flying to Florida for, we realized, wow, these EKGs and things could have been done at home. And now I'm hoping that the clinical trials and pharma companies are realizing that we don't have to fly there, and all the burden of having, when we're flying, we have a wheelchair and a service dog, and it's just a lot. And so if they can change up some of that and make it where it's at home, it's been a true blessing. And so now, instead of going every 3 weeks, we go every 4 months. So it has been a huge difference and learning for the pharma companies that we can do it differently.
Sure. No, that sounds like a tremendous impact. So you're still every 3 weeks doing something locally, and then every 4 months, or has even the 3 week?
The 3 weeks has finished up. We did that for 3 months, and
Okay.
having a nurse come in to draw labs. And then once that was done, we got checked one more time, and they said, see you in 4 months. So we go back in March.
Wonderful. Thank you, Jessica. And Diana?
Yes, so we were in a clinical trial for 1.5 years. Jordan was doing great in the trial. It was canceled not due to COVID, but it was canceled during the pandemic in October. So during the study, it was a steroid alternative medication. So he was taking 7 pills a day, and then it grew to 8 when he gained some weight. So he abruptly stopped that medication immediately when the trial ended. And we, were in the process of talking to our doctor about, putting him on steroids and, which steroid to go to. And then, we had to go through the approval process. And during that time, there was about a 1-month period where he was not on, obviously, the study drug or steroids yet. And he just really I was getting concerning emails from his teachers that, he was dragging his legs and he was kind of slithering around, that he wasn't doing just the week before. So of course, then I'm trying to rush, get him on steroids. And we ended up having to go through, exhausting our appeals and an external review before finally getting approved for the more preferable steroid Emflaza. But it was a very draining experience. For him, of course, more than for me. But for me, I had made the decision to put Jordan in the study to begin with. So I felt as though, when the study failed, did I make that decision right? Did I now waste 1.5 years where he could have been, doing something else? So it was very emotional, and that was tough for everybody. But now he's on Emflaza and he's doing very well with that. So I'm thankful for that.
Well, that's great to hear that he's doing well now. Was there any of that transitional period that was more complicated as a result of the pandemic, or you think it might have been similar?
Well, to be honest with you, when I first called my neurologist and said, we got to get in for an appointment, Jordan's off his study drug. They said, okay, well, the first opening is, 3 weeks from Tuesday. And I said, well, can he squeeze me in for a telehealth tomorrow? And they ended up doing that. So that kind of worked in our favor. They couldn't push our appointment out. So that was good. But yes, I think that being home alone and just having the pandemic on top of it maybe was a little bit of added pressure. But luckily, I have a lot of resources that I was able to, connect with virtually, and so we sped up the process of getting him on a new treatment as much as we could. So we did the best we were able to do with that situation. But it was also more kind of explaining to Jordan, who was used to taking 8 pills a day, which we refer to as vitamins, why he was no longer taking those and why he was going to take something new. And then, which was prednisone, and then take something new again when we got approved for Emflaza. So it's not only kind of explaining to him what's going on, but having him give us feedback at 6 years old as, are you feeling okay? How are you doing with this? So all of that kind of transition in medication and treatments while going through the pandemic was just an added layer of stress, I think.
Yeah. Well, thank you all 3 of you for sharing these clinical trial experiences. I know We do have researchers and drug developers in the audience, so hopefully there's useful lessons to take away from each of Javon, Wyatt, and Jordan's experiences. As we wrap up this panel discussion with our ambassadors here, we have highlighted a lot of the impacts and challenges related to COVID-19. But in talking to these women, I heard from each of them when we were preparing that there were also what I'll call silver linings, little positives, experiences that maybe wouldn't have otherwise occurred if it wasn't for the really unique world we're living in right now. So I'd love to go around and hear what those were from each with you, and maybe we can start with Blake.
Sure. So I think the biggest thing is, despite all the family quality time we've had, we actually probably as a family are closer than ever. And I think, I think it's been good for my daughters to, kind of balance that, need of social interaction, but also they're so fiercely protective of their brother. And so it's been really sweet to see them wanting to go that extra step. But I think too, as a society, we've just realized, hey, there's a lot of easier ways to do things sometimes. And so, whether it's the virtual health visits or, logging into school virtually if you're not feeling well or have doctor's appointments. And, and one of the things is my son loves Camp Promise. I mean, that's one of the highlights of his year. And as a family, we were all very sad that we didn't all get to share that week break from each other. But I mean, they quickly adopted, the kind of the virtual camp experience, but then that programming became year round. And so he's having this connection throughout the year. They had one last night where I think they were doing trivia. And, there's very few ways that he gets to put out his independence and, but that Can't Promise Zoom call. I mean, he powers that up and then it's close the door, mom, and, 2 hours later. And so that's just been fantastic. And so I think, his church youth group kind of did that too. So I think other people will maybe start getting that, there are easier ways, or we can be more inclusive if we just kind of rethink how we go about things. And I think that's been the biggest thing, that society finally kind of gets to walk in our shoes a little bit and then maybe make some changes long-term that, lessons learned from this COVID experience.
That sounds so wonderful. Thank you, Blake. Laura, how about for you and Noah? Silver linings.
Well, there's been several. So Noah has decided to take it upon himself that he and I compiled a list of several silver linings. So I'm going to read this. Oh gosh. So we have an amazing playlist on Spotify now, like beyond, it's amazing. Like we should be DJs. Like this is awesome. We've completed all puzzles. We have marathoned Marvel movies 5 or 6 times. We have our mastery of Mad Libs is beyond compare. We are Netflix Jedis. Yes, that's a Disney reference to The Mandalorian, but we've also very good at Netflix. Okay, we've improved all of our dance moves. Like we are amazing. Singing, no. Just ask my daughters, no. Singing has not been good, but dancing is great. We have a forced togetherness that has turned into, he said, a voluntary, organic-like togetherness. So that's pretty cool. So I think he also learned the word organic over all this time. The kids are very bonded, and mom has even more precious time with her boy. And mom has also gotten more time to run because both of my daughters who are 18 and 16 are virtual schooled, so they can watch him while I run. So that has been important. And just taking it slow, realizing every day matters is a silver lining, and loving each other unconditionally. Pretty good list, Noah. Thank you.
A wonderful list. And I think maybe the common theme that I see or hear through that is, this special additional time that we have together with our families at home that, yes, can be that challenge that we talked about, but would never have been able to, make that killer Spotify list probably if you didn't have that time. So
because it's awesome. So,
yes, thank you, Laura.
yes.
Well, I hope you'll share that list so we can, search that amongst all the participants today. save us all some time of having to do the work you've done. So Jessica C, silver.
I mean, I think for us, there's several that have been mentioned. We were able to slow down and have that quality time with family. We all get caught up in the hustle and bustle of life and cramming it all into a day. We saw community come together and help us meet our goal for getting our van through the Jett Giving Fund. And then for Javon's a very passive, laid back child. He's quiet, he's an observer. And 2020 was the year he was going to finally attend and participate in a camp. Well, here we go. So Camp Promise, again, like Blake said, is amazing. And it's been that outlet, and it wasn't just a 1 week and done. It's extended through the whole year and met the different social needs.
That's great. Thank you, Jessica. R.
Can I just say everything Elaval said? Blake, I feel like you're in my head all the time. Our kids are so much the same, but definitely the time at home, and the kids learning to support each other more and care a little bit more about being respectful of one another's needs. And I think Wyatt's kind of taken more of a control of his life, which, you know, I'd send him off to school and I have no idea what really happens besides what the aide says. And I think he's kind of learned how to balance some things better, and which is great, even though I think he's dependent on me, but I think he's grown up some over this year to be able to now ask for things and be more of his own advocate. Plus, Camp Promise has been amazing. If we can't say that enough.
Oh, that's wonderful to hear. And the final word to Diana.
I got to get Jordan into Camp Promise. Now you all convinced me, so I'm going to do that this summer. Blake kind of mentioned this a little bit, but you know, I think that a health crisis, any health crisis, really changes you. I know it changed our lives overnight, abruptly, and you know, we already know what it's like to not have answers to scary health questions, and we kind of already know this experience. It's familiar, but people outside of the rare disease community, outside of the Duchenne community, maybe can have more empathy for us now, and you know, a better understanding of what we'll continue to go through even after this is all over.
Well, I want to thank all 5 of you for taking time out of your very busy lives to share with us your experiences over this past year. What I hope is that all of our stakeholders are committed, Jett Foundation staff, you know, the researchers and other allies that we have tuned in, and drug developers can learn from what you shared. You know, we can find more opportunities to help you know, overcome these impacts and challenges, because if you shared them, then you know, I think we can feel pretty confident that many others out there are experiencing them as well. And so, you know, in honor of Rare Disease Day, hopefully we'll take these away as our to-do list for this next year. So really appreciate that. So now we're going to get to the part of the agenda where we're going to build on this discussion, you know, that we heard from our ambassadors related to these challenges in terms of care and in conducting clinical trials. And we have 2 great panelists for this next discussion who are going to be sharing their experiences kind of in the field and their thoughts about overcoming these challenges. So to kick us off and talk about impacts on care and clinical trials and some of her thoughts around overcoming them, we have Dr. Phan. Dr. Phan is a pediatric neurologist and sleep specialist who's highly passionate about clinical trials in neuromuscular diseases, including very specifically Duchenne muscular dystrophy. She's a member of the Pediatric Advisory Board at FDA, as well as a guest researcher at the CDC Newborn Screening Branch. And she's currently an associate professor at the University of Alabama and co-director of the MDA Clinic, amongst many other things that she's involved with. A very busy woman. But please welcome me in joining. Welcome me, and having Dr. Phan share her experiences over this past year in caring for individuals with Duchenne muscular dystrophy. Dr. Phan?
Thanks, James. The mute buttons always get to me.
They're tricky.
So I first like to thank the Jett Foundation for the opportunity to speak. And I'm also very appreciative and thankful for the ambassadors. I mean, just sitting here and hearing your life story and life experiences with us is immeasurable. Your advocating for your child is invaluable and highly impressive. I'm always awestruck every time I meet one of you. So thank you. Yes, I think one of the questions has always been, how has COVID impact our clinical responsibility and seeing the patients and evaluating patients? So fortunately, because of the vaccine that's currently available to healthcare providers, all of our clinic staff have been vaccinated, but not only to protect ourselves, but also more importantly for our patients and their family. When patients are scheduled to see us in clinic, a number of mitigation procedures and protocol we have placed are to limit patients to the clinic. We have several locations in which we see patients, so sometimes we can disperse the patient in different locations depending on the number of patients we see on those days. Our goal is to limit one patient per hour per area of visit. Sometimes that may or may not be feasible, but that's what we try to strive for. Our patients, when they do arrive in clinics, are in an enclosed room with doors closed, and only the relevant staff are permitted to go into each patient's room just to minimize the exposure. Before any of the clinical visit, we perform a pre-screening questionnaires just to also, again, to ensure that patients and their family are healthy before they come. And we do the same for our our staff here. Is before they come to work, they get a link in which they need to answer if they have any COVID exposures, fever, any of the COVID symptoms. And of course, our facilities are oftentimes clean before and after each patient's arrival. So I think hopefully, the way that we have conducted our clinic visits have been able to mitigate a lot of the risk that is inherent in coming into a clinic when you're exposed to a number of patients, and not to defeat the effort and the drive that all of the ambassadors and of course all of the families out there who have been putting out a good effort to quarantine their families and their child.
Thank you, Dr. Phan, for those important kind of summary of what's been a great deal of experience that you've had over this past year. I think one question that I have for you in terms of maybe more directed at clinical research, but maybe this could apply to routine clinical care, is do you think that there's, COVID-19 has really made it more difficult or easier? We kind of heard a lot of the ambassadors talking about, how great telehealth has been and reducing numbers of in-person visits. But we also heard you describe so many, added precautions that need to be taken. So would love to hear your thinking about that.
Sure. So for us, we fortunately were able to implement rather quickly protocol to mitigate risk for our patients. Given that some of our studies are either weekly infusion, biweekly, or sometimes monthly infusions, we unfortunately do not have the luxury of just closing our clinics. So we try our best to mitigate the risk by, of course, implementing protocol. But also, as you may be aware, that our families are highly motivated and passionate when it comes to coming up to the studies and showing up on time. And so a lot of the families, including one of our ambassador family, instead of flying, she chooses to drive and literally every other week she drives with her family. And you know, they come, they get their infusion, and they go home. So, you know, to me, I think that speaks highly of the family and the dedication that they put forth. And you know, it's, you know, I have kids, and I'm a mom, and you know, whenever my child has an ear infections or whatever it is that the pediatrician prescribed 10 days of antibiotics, you know, after 7 days, I'm just, oh, I think it's done. So, you know, and you know, so it just to say that, you know, the dedication is absolutely what we are all impressed, and we're trying to keep the study open so that the family will not miss any visits or infusions or any treatments or therapies that is included in the trials.
Sure. Thank you so much. And I know we're going to save some time once we've had a chance also to hear from Christine to open it up to the audience for any questions. But I will want to mention that now in case you had any questions based off of what you heard from Dr. Phan, or if you have thoughts or questions that would be relevant for her, you can go ahead and enter those into the chat. And that way we'll be able to answer those towards the end of this panel discussion. So without further ado, I want to give Christine McSherry a chance to also weigh in on this topic of the challenges, but also the opportunities as a result of COVID-19. I'm sure Christine needs no introduction, but for those of you who maybe don't know her, you should know that she founded the Jett Foundation when her now 24-year-old son, Jett, was diagnosed with Duchenne. As the head of the foundation, she did so much, but included co-founding the International Duchenne Alliance, which is a partnership of over 40 independent organizations that has funded nearly $15 million of research to date. And she has also been a tremendous advocate for the Duchenne community, including with the FDA and ensuring that your experiences and preferences are considered by them in reviewing safe and potentially effective treatments for Duchenne. She also she is here today in her capacity also with Casimir Trials, a company that she founded to help advocate for rare disease families through research and ensure that the patient experience and patient preferences are captured in clinical trials. So I know that you've been active, Christine, this year with Casimir and the impacts of COVID. So would love to hear your views on the role that COVID has played on clinical trials and opportunities that you see.
Yeah, thank you, James. Thank you, everybody at Jett Foundation, for providing the opportunity. And Dr. Phan, we want to thank you on behalf of the community for taking such good care of our community and all of our kids. I'm really happy to be here today, and some of you I can see and some of you I can't, and some of you I'm going to be able to see if you put your fingers in your ears, but you know what I'm going to say. So COVID has really given us a tremendous opportunity in rare disease to examine some things that are meaningful to patients and other things that are not meaningful to patients. Unfortunately, today in our community, we have 40 failed clinical studies. Many of them are on time function tests, and many of them are on other things. And something that Mindy Leffler, my colleague, and I have been focused on is really trying to understand what is meaningful to patients and what are the best ways in order to capture that meaningfulness. And I don't know, James, if I can share a quick slide, would that be okay?
I have no problem, as just make sure that you have the ability to do that, and I'll defer to the Jett Foundation. Yep, it looks like
I can. Okay.
There you go.
So just really quickly, like I said, I'm gonna move so I don't see all you people, but I see.
You can put it in presentation mode so we can see it a little better.
Yep.
Perfect. Thank you.
Okay. So one of the things that I wanted to highlight, which I think has really come out through COVID over the last year, is the way that drugs are supposed to be approved to rare disease. And the way that they are supposed to be approved is on how a patient feels, functions, and survives. And so you can see here, Jett, in 2017, after receiving drug for about 3.5 years, he got something back that he had once lost, and that was his smile. And while it may not make a clinical functional endpoint difference, as you can imagine to me, my family, my sons and daughters, how important it was that we actually got to experience Jett when he smiled. And so that's important, and it can be quantified. You know, we started Casimir as a remote capture company before COVID even hit, because we realized that what were happening in the homes of our children was really important and wasn't being taken into consideration. And there are confounds to traveling for assessments, as Jessica travels, you know, 3 to 4 hours a day to her, every 2 weeks to her site. And these are just some of those reasons. This is just a quick list. It's not all 40, but it's up there. It's about 30 something of the studies that have failed in Duchenne. And as a community, for me, this is just heartbreaking. This is something that we can't continue to allow happening. Our kids end up with post-traumatic stress disorder as a result of being in some of these studies. It hurts. They become scared. They have more anxiety. And at some point, we've just got to figure out a different way to do things. And many of you have seen this slide before. One size does not fit all in rare disease. Kids, while we can predict their progression, their progression is different. And so just kind of acknowledging somebody as they come into a clinical study, where they are they actually on the getting better end of it, the honeymoon phase, or are they on the other end of it, which is starting to fall and progress in their disease? And then it's really the caregivers who can give us that important information, instead of kind of meshing the two cohorts together into one, just because you want a spectrum of ages 4 to 7 and a functional baseline. And then this here is really heartbreaking to watch, but this here is a, if I can get to play, this is what it looks like to participate in a 6-minute walk test. This is the reality of actually what's happening to our kids behind closed doors when we don't always see, because we might be in the waiting room. But this little guy gets back up and goes again, and I'm sure many parents watching are familiar with that. And then the difference is, this is something that happened to a boy that was meaningful. That 6-minute walk test, that time function test, didn't mean anything to him. But yet we have a young boy here who starts at baseline not able to do a task that he identified as important to him, to being able to do it with a little bit of difficulty, to then going to doing it in a very neurotypical way. However, may not have performed the same on the 6-minute walk test or any different. Same thing here. This is something that's important to a young man in his bed. You can see he's going to have difficulty sitting up in the bed. And then he's not able to sit straight up. He kind of falls forward. And that was time point 1. And this is time point 2. He's able to sit up. He doesn't have to call mom in the morning to sit him up. He's able to do it himself. So I think when we look at COVID-19, this has allowed us to kind of really examine these concepts and understand the concepts of interest that are important and meaningful to patients. And then, you know, people have been really creative about trying to do these assessments at home, which is something that we've been advocating for since 2016. And we're finally beginning to see some flexibility come through in the community, not only the Duchenne community, but other rare disease communities. And so that's what's really exciting to me. And I think that's one of the biggest pieces that we're actually missing in Duchenne. And so just, I know I'm going to see a lot of this later, but that's okay. You guys can hear it again.
Yeah, so thank you, Christine, for talking about the needs for this really patient-focused evaluation of treatment. With this focus on the impacts of COVID-19, have you seen that because these are remote or decentralized approaches that have those that were already ongoing been able to continue without interruption despite the pandemic? And what about new trials that maybe are being designed, or do you see more of a willingness to incorporate these types of assessments?
Yeah, thankfully we've seen a willingness for people to start to include these assessments. in their studies. And I think it was kind of like us all starting to work from home and doing things from home and realizing that we do have the flexibility to begin to do assessments in the home. And it also kind of peeled back the onion a little bit on what assessments really look like with our kids when they're done in the clinic. And the fact that sometimes, well, most of the time, parents are not in the room with them. But now, as a result of COVID, we've actually, we've seen remote assessments done, ones that are typically done in the clinic being done at home. There may be a better way, and there may be a way in which we do it that's more functional for that patient where they live. So, for instance, they sit up from a chair on a clinic chair in an office, but is that really important to them? Is it more important that they actually are able to get up off their own couch by themselves, and you can continue to use that couch throughout the whole study, right? And so I think that this has definitely allowed more flexibility in the community, and I think I've heard from parents who have also said that they wish they had the opportunity to participate in these types of studies, and that's sad for me to hear as a parent. But I'm hoping that we can work together, create the SOPs that make everybody happy, and start to see this flexibility, these types of assessments in studies, and reduce our risk, not only of COVID, but reduce our risk of confounding data.
I just want to make a really quick comment because I know, Christine, you and I have talked about this, and I just wanted to jump in because Jordan has literally had this experience. It's not just necessarily being in the clinic that might change the result. It's also getting to the clinic that might change the result. And I live here in Connecticut. Our clinical trial was at Boston Children's. It's only a 2-hour drive, but that requires us to go in overnight. So he's going to bed later in a hospital. He's waking up earlier. By the time you drag him there, of course, he's not going to perform better as he would if he were in my kitchen in the comfort of his home. So it's not just the actually being in the hospital, it's getting to the hospital that could impact the assessments. And I do feel, because I've looked through, why our study was canceled as to, what happened. And it really hits home everything that, Christine, that you're saying about trials. So I just wanted to share that.
Thank you, Diana. And I mean, what Christine, you've, kind of mentioned in terms of, impacts, and actually Dr. Phan as well, I mean, this has been, from my experience, working across many different rare diseases, not a unique experience. It's very common in rare diseases. And it's been interesting over the past year to see the ebb and flow. Originally, we had, many stay-at-home orders. I mean, there was a lot of restriction. We were worried about hospital capacity. We saw many healthcare centers, repurposing their, many of their rooms to be for COVID capacity. And then over the course of the kind of waxing and waning of infection rates and hospitalizations, that this is kind of over time impacted different geographic areas more or less, and that could impact lots of different clinical trial sites differently. And kind of with the regulatory work that I do with the FDA, it's been kind of a evolving situation. At the very minimum, the FDA, and I think rightfully, has been saying we need to capture all of these impacts. We don't necessarily know how to overcome all of them right away, but at least if we know what aspects of a trial, whether a protocol deviation, as a result of, a missed, or maybe not altogether missed, but missed with outside of the scheduled window of a clinic visit, or a dosing of a product, or some kind of evaluation assessment like Christine was talking about. And then of course, people actually were infected, and that has had impacts. And as we heard from our ambassadors, there's a great deal of anxiety, about leaving the house and doing things that might be, higher risk. And Dr. Phan, I think you nicely described it. This is a highly motivated patient community here. And so many people, push through and do come, and do the visits and do the activities that they need to do. But we're finally starting now to see results of trials that have been going on over this past year. And, we're seeing that there is that confounding, that there, is a lot, there's missing data that we have to account for, protocol deviations that we have to account for, but also just differences in, changing of performance on outcome assessments. The example of the 6-minute walk test, just as one of them, since we just saw the demonstration of that, people may or may not be doing as much activity in their daily lives because they're, staying home, where they're not getting access to their normal physical therapy. So there's a lot of things that could, impact, someone's, ability to perform a walking test like that, or any other kind of test, or maybe even how people report on what's called a patient reported outcome measure, where you're reporting, how you're feeling or how you're doing on something. And, I think we're in a place where we don't have the answers yet on how we should be accounting for, these different variables. In rare diseases, our trials are already so small that often they're hard to interpret. We don't have the ability to do 10,000 patient studies and multiple 10,000 patient studies where we can very easily pick up on treatment effects, where we don't have that luxury in Duchenne muscular dystrophy. And so, when you layer on top of that all of the added uncertainty that these types of issues create in trying to interpret results from these studies, it's, to me, an unfair added burden on rare diseases. While all clinical trials are going to be impacted, even for really common diseases, they have more of a margin for error. And, as we heard from multiple ambassadors, time is ticking for every person living with Duchenne. And so, to need to go and collect more information just because we can't, it's harder to interpret data from trials that we have now, seems unfair to me. So hopefully another call to action for all of us involved, all of our researchers, our clinicians, our drug developers, our regulators, and all of you in this community will be to really focus our thinking and spend time trying to figure out how we can best use the information we have. And certainly when we have information that would be less confounded, like remote or decentralized assessments, the better. But that's something we can aspire to more. So looking forward, we might not have that benefit of having that in all of the trials that have been ongoing. So just wanted to share my 2 cents from where I sit on this important topic. But before we wrap up, want to turn it over to Danielle Edwards, who heads community engagement for Jett Foundation, to ask any questions from the community.
Hi, everyone. I will be moderating the questions. So right now, if you guys have any questions for our panelists, please feel free to drop some in the chat. We already have one for Dr. Phan though right now that I think will be the best for this. How does COVID-19 affect children with Duchenne? We are a newly diagnosed family. Should we be taking extra precautions? You're on mute. I did it too. It's tough.
All right. Sorry about that. So I think we all need to take precautions, and particularly not only for our family, but for our patients as well. At our clinic, we really screen for those who go away and even with just vacations or visiting families. But I think particularly for our family and our patients, anybody who is on steroids or immunocompromised should be careful. Some of the ways to mitigate risk, of course, is schooling. And that's really tough decisions for a lot of families because not only learning, but also sociability as well. So I think that's a really tough decision to make. But for all of our patients, we need to be careful and take precautions. Not only the older one, but also the younger one that's newly diagnosed. And I'm happy to talk and discuss more on at individual levels in terms of what topics and what other questions you may have, including schooling, clinics, and other environments that I'm sure Daniel can provide my contacts to you. But yes, we do need to be careful. Fortunately, most of the patients who I've had with COVID infections have recovered well. One ended up in the hospital on a ventilator for 5 days, but fortunately he recovered well. So you see sort of the extreme of that, and then some of the kids are just perfectly fine. I just had one who contracted COVID from his dad, and he just has some running nose. So it's really hard to predict where your child will land, but I think it's best to be cautious and careful.
We have another question that might be for you as well, about the AAV vaccines and how they might affect treatments in the future for those with neuromuscular diseases.
So the current two vaccines, Pfizer and Moderna, are mRNA vaccines, and those will not affect your ability to participate in clinical trials, particularly for gene therapy. So if possible, those are the two that I would get. There will be some AAV vaccine that will be available, and I think the data is still not fully analyzed and published yet, but I think those may be questionable. But Pfizer and Moderna are the two that, even if your child received that vaccine, if he's eligible for it, should not affect your eligibility to participate in gene trials.
James, I might just go off and ask one for myself. We talked, obviously at Jett Foundation, we believe in the patient's voice here. Have you guys seen a more increase, in the patient's voice, especially going back to the FDA as well, and especially with things being with COVID? How has that changed being virtual?
Sure. So I'm happy to start here. I don't know if maybe Christine might have thoughts about this too, but from what I've seen, I work with directly with a lot of patient advocacy organizations and help them in bringing their voices to the FDA. And so, at the beginning of last year, we had been planning a number of in-person, what are called patient-focused drug development meetings. I know there was one a few years ago in Duchenne muscular dystrophy that was an in-person meeting. And so, all of a sudden, we were entering this new world where the federal agencies weren't allowed to attend large gatherings. Eventually, we got to the point where travel restrictions and even stay-at-home orders were going into place. And yet, drug development was not stopping and regulatory decision-making was not stopping. And so we couldn't just put those activities on hold until the pandemic passed. And so what I've seen is over the last year, we've been really creative in finding ways to bring patient voices directly to our federal regulators at the FDA. We've created kind of almost like teletown hall format meetings that's almost like a hybrid of like a news show, something like Anderson Cooper, where he's got a panel of his experts that he can go to, but then they'll bring in others, by video, and then they'll, kind of add in the teletown hall aspect, and you can hear from many, many people. One of the things that I've actually found to be a real benefit of doing this type of more virtual interaction, and this is really relevant to Duchenne, is that many people wouldn't have had the ability, or wouldn't have been easy for them to travel in person to these meetings. And so we probably were biasing these meetings a little bit more to those who were most mobile, or maybe least progressed or least sick. And so FDA was only seeing part of the story. And while you could try to bring in testimonies and things like that from others that weren't there, the most of the time was spent hearing from those in the room. And so in this virtual format, anyone can participate from anywhere. And so I think you're really seeing a great, more really representative patient experience, which is important for FDA to hear.
Thank you. I think we have 2 more questions and then we'll wrap it up. Is it safe for a 21-year-old with Duchenne to take a COVID vaccination of either Moderna or Pfizer? Dr. Hahn?
So the age limitations is what will limit a lot of our patients. So for the Pfizer study, the clinical trials for that vaccine, I think that 16 or older are eligible for that study, or to receive the vaccine. And for Moderna, it's 18 or older. So if your child, unfortunately, if your child is less than 16 years of age, then I'm not sure if any of the pediatricians or provider could provide the vaccine to your child. Currently, they do have ongoing clinical trials for younger age groups, particularly for Pfizer and Moderna. So I'm hoping that those data will be out soon so that the vaccine will be available to our patients.
Thank you. And then the next question we have is for Christine. Are pharma companies open to using the Casimir information as endpoints, and is the FDA on board using the useful information instead of the 6-minute walk test?
Yeah, so I would never want to speak for FDA. I'm not in regulatory and would never put myself in that place, but I can tell you that they have, we are partnered with the Critical Path Institute, which with support from FDA to go through the qualification program that will make it a qualified endpoint, we hope, with some longitudinal data. So we're still waiting on our longitudinal data. We hope to have that shortly. And then we'll be the only outcome measure that's qualified, as far as I know, in Duchenne. We do believe that the outcome measure is validated at this point, so it can be used both maybe for a secondary and an exploratory endpoint. And yes, more and more companies are beginning to implement it either as a secondary or exploratory.
Great. Well, I think we're at our time here. And so I want to thank both Hannah and Christine for your participation. This has been a great discussion and really, I think a start of a longer discussion that we'll need to continue having on how to learn from these experiences and, drive care and research to continue to be, more patient focused. And I think, we've tested things that maybe we weren't able to test out before in terms of how we do those things this year because of COVID. So that ends our programming in terms of all of the great insights we have from this community. And I'd like to now hand it back over to Eric Snyder to close out the program.
James, thanks so much. What an amazing afternoon that we've all spent together. And I looked over at the clock. I'm like, my gosh, it's been an hour and a half, and it went by like that. And that's an indicator that there's been great discussion. And I couldn't be happier for all of you that have participated today. James, what a great job moderating. I got to tell you, I've been in a lot of these situations, and you facilitated a meeting really well. So I want to thank you for all your efforts today, drawing out, valuable information for all of us. Dr. Phan and Christine, thank you for lending your expertise and insights today, and for everything that you do to support the community. Thank you. Our Jett ambassadors, you guys, thank you, ladies. Thank you so much. Your personal stories, your experiences, describing both the challenges and some of the silver linings that has happened over this past year plus. It's invaluable information, and I really appreciate you taking time to share it with the collective here. Last but not least, to all of our sponsors today, we thank you for your partnership and continued support of the foundation. For those of you that may have a question that you weren't able to ask, or you want to poke a little bit further about any one of the variety of topics discussed today, please reach out to us at Jett Foundation. We're happy to assist facilitating and making sure that the right people are talking to the right individuals. Our silver lining, as was talked about earlier, we were forced into a virtual world, and it's been nothing but a blessing for us at the foundation. where we've been able to keep the community connected through Camp Promise and our ongoing meetups, our virtual webinars, and so much more. So although very challenging, again, here, it's been a blessing, and we're always here to help. So please look at our website, check out our calendar of events, and we hope to see you more often. Thanks for everyone for attending today. I wish you the best rest of the day and an awesome weekend. Bye-bye now.